Okay.
Ready as we'll ever be.
Okay, so here we go. So Dr. Chris Nelson here.
Dr. Mike Nelson.
Yeah, and so today we just want to do like a summary of day number 2 for Seattle Study Club Symposium. Today was a half day, so up early. Courses start at 7:45.
It's a half day, and that's why it's 4:30, and we're just getting ready to go back to the room.
Yeah, half day.
Yeah.
4:30. 4:45.
Yeah.
So today was really packed. You know, yesterday we talked about some really cool courses. AI was a big one, and you know that was pretty impactful. Everybody that I've talked to said toothwear. Yeah. What else? And those are the 2 big ones. The AI lecture really has stuck with me.
Yep.
And you know, a lot of the dentists and non-dentists I've talked to today, I'm like, it's like, what course did you like? And they're like, the AI one. That one was crazy.
Frightening.
It's frightening, but it's exciting.
Something. Yeah, I've used it today.
What did you ask ChatGPT?
Oh, I said, how to lower my triglycerides.
Okay.
I think I know, but I thought, I want to get a second opinion.
Yeah.
And that's one of the things that they talked about.
That's right.
They said sometimes it's not the greatest for first opinions, but you have information.
Yeah.
Ask some questions and have a conversation with ChatGPT or one of the programs and get a second opinion.
Yeah. Yeah. Yesterday I made a whole table of cost comparison between 2 different procedures, one that we're considering implementing and another one that we're already using. So that was interesting. But let's move on to today. We had a number of lectures, like six lectures today, and I thought there were some really great ones. So we started out with the evolution of healthcare and why it's important.
It was a physician who had worked at Mass General and Harvard for 30 years, and now he's down, I think, at Emory.
Yeah.
And it's like, who would go to a dental meeting and hear somebody that's not a dentist talk about the overall direction of healthcare? It's always a stretch to come here.
Yeah.
And it was great. It was really great.
So that was a good way to start the day. And then we also had Tony, Dr. Mennito, and you know, his lecture was on 3D printers. I actually had, the neat thing about Seattle Study Club Symposium, at least, is, you know, I had breakfast with Tony. I just sat down at the table and we were just hanging out, and, you know, I was like, hey, he looks familiar. And then I'm like, oh yeah, he's been in the program thing. And so he was talking about, you know, what he was getting ready to lecture on 3D printers, and I was asking him some questions, and it just is like, just normal, you know?
Everybody is available, everybody's willing to talk, and you have plenty of time to get any questions answered.
So he talked about how he can't imagine working without 3D printers because basically it gives him more options. So that's something that we're going to be talking about and thinking about is, you know, when and what, how would we integrate that into our practice? Currently, we don't do any 3D printing in the office. We have our wonderful lab partners, mainly the Foresters in Shasta Lake, and they help us with a lot of things. They'll do a lot of 3D printing of models and other items, but we aren't using 3D printing in the office for anything. So that was an interesting one, and I already have a few ideas that I'm not really ready to share yet, but some ideas about how we could use 3D printing. Now, the main thing though is for me, and I think you'd agree, is that if we're going to use something new, it needs to be as good, if not better, for the ultimate patient care.
Absolutely.
I mean, now that I own the business, and I think it's the same way when you own the business, you wouldn't make an investment just because it saved you money or even really saved you time, but it would need to be it would need to be equally as good. And maybe also check those boxes.
Sometimes you make a purchase because it's fun. It scratches an itch that you have. You like to do those things. But ultimately, if it doesn't elevate the care for the patient, then why do it?
Yeah. So the 3D printing concepts, there's also discussion of in our profession right now, milling of crowns, taking a block of material and making it smaller to make a crown or something is very, very common, and it's done in the labs and in offices. Well, the discussion is 3D printing, the substitution for that, long term moving forward. So that's something that I've been thinking about as well.
And in some ways, it might be conserving materials, because instead of having a block and then wasting 4/5 of that block and turning it into powder and waste, you just use what you need to make a restoration, a mouth guard, a surgical guide.
Well, plastics and waste is a whole separate.
Yeah.
We won't get into that, but it was a really good lecture. It was thought-provoking, and it was fun hearing his perspective and seeing how he's implementing and kind of getting the current state of 3D printing, and a little bit of future.
Yesterday we talked about some concepts, and today we're getting into a little bit of how-to and nuts and bolts and structural integration of these concepts.
So I wanted to hit on one other lecture, which was with Ashleigh,
Dr.
Briody.
Yeah.
And she talked about, her title was Behind the Smile, a Pathology Perspective. She shared a really powerful story of a patient that had...
First person.
Yeah, that had oral cancer, cancer on the tongue.
Age 24, healthy, exercise, rock climber.
Yeah, and without sharing too many more details of the case, essentially is just like a patient that wouldn't necessarily be at risk, no risk factors that were disclosed, and it's just crazy to see that. Now, we have patients, I was watching that, and 3/4 of the way through her talking, I was thinking about a couple of our patients who have had resections, jaws resected, tongues resected. We have some personal stories that we don't need to share as well, of people that we know really well that have had oral cancer. So that was interesting, and one takeaway from that I wanted to share was a language opportunity for how to talk with people that are going through that or went through that, because she said she interviewed the patient and asked the patient, how do you want people to interact with you about, what you went through? And one of the things do you remember do you remember that?
What I remember was sometimes people will say, well, were you a smoker? Well, did you have the HPV virus?
HPV,
And what
kind of
why did you get it?
Yeah.
And what did you do to get it? And
it's like it's your fault that you got it.
Right.
And so the narrative there was, maybe use different language, like maybe don't ask them, are you a smoker or do you have HPV? Like maybe ask them, are you willing to share your story? Well, I think what I kind of heard was, are you willing to talk about, how you think this happened? Or, I think the general message is maybe don't be as direct with your questioning and be more general of, tell me more about what happened.
Hey, it's all about supporting that person at that moment and in the future.
Yeah.
And if there's something to be learned about causative, that'll come out, but let it come out naturally and organically.
Yeah, and don't put the person on the spot to feel like they have to disclose personal health information to answer your question just because you were curious.
It made a point, though, that that is always good for dentists to see, the importance of a careful, thorough oral exam and documenting it. And with the ways we have with scanning and photography, it's really so much easier to stay on top of things.
So when we're doing hygiene exams, as an example, because we do a lot more hygiene exams during the week than new patient exams.
Oh, certainly.
So when we do hygiene exams, we're doing oral cancer screening, and like my workflow, I use language like lips look good, buccal mucosa looks good, gingiva looks good, roof of the mouth looks good, floor of the mouth looks good. I'll go through all of those and mention whether it looks good or not good. And then use those opportunities to have a discussion. And then also, really importantly, we have little wand cameras. They're like selfie cameras on a stick, and we can use that to take a photograph, either a photograph by itself or a photograph with a measuring device in the picture to document that. So even if it's something we don't end up referring, we can document it and look at it next time.
Reevaluate it.
And then our hygienist typically would make a note that says, hey, we need to go back and look at that. Yeah. And I can think of several patients in the last couple weeks where, I was saying, hey, I don't think we need to do a referral at this point, or do you want a referral? But we're going to document it either way. So that was a really good lecture. And then we finished up with behavioral economics and in healthcare. And do you have any points?
People to change?
Do you have any points about that? I have one.
Well, I think he was talking about an example of trying to motivate somebody to change by giving them a reward, or by having if they didn't achieve their goal, then they had to give something up.
Yeah. So it was a study that they did where they gave people $1.40 a day, or a quantity of money for a month, and then
if they achieved a goal each day, like taking their vitamins or
they had different categories of no financial incentive, a lottery incentive, and then we gave you the money, and then we gave you the money in advance, and we took it away. And the most motivating factor were the people who had money taken away if they didn't do the behavior.
If you give them like $40 for the month, and if you do it every day, you get $40. You can either earn it $1.40 as a reward every day, or you get your $40, and if you don't do it, you have to give back $1.40.
Yeah.
And the people that had the most success on the program were the people that were going to have to pay $1.40 if they didn't achieve their goal.
Yeah, that was really interesting.
So how do we incorporate that?
Well, I think we're going to start paying patients for the exams up front. So we pay for it. And then if they have any bleeding, any 4mm probes, or any cavities, then they have to pay the exam. And it ends up where it's going to be the same fee anyways, but the incentive will feel different.
Well, it's all about motivating people, educating people to have health for life.
I agree. I mean, I think one of the hardest things that we do is change people's behavior. And I think that's, as a human, that's like a hard thing to do, is change behavior. Yeah. So anyways, that's a wrap for today. I hope you found it interesting. We're looking forward. We have Friday and Saturday, 2 more full days. And I'm pretty tired. I think we're going to go for a walk after this. It was a long day. But
it was supposed to be over at noon.
Yeah. We had a lunch meeting, but it was a long day, and the lunch meeting was really interesting as well. So,
unbelievable.
Yeah, we met Gary Takacs and some others, and we, even after the lunch meeting was over, we were just chatting for a really long time.
Going back 20, 30 years in history.
And it was just so fun. And I guess maybe that's the thing we wrap on for today, is the main thing are the relationships, like kind of bringing it back to meeting Dr. Tony at breakfast, and like all the relationships and that you get to build with other people. And what you find out is that we all kind of have a similar mission and vision, but it's being executed in different ways. And it's just fun to connect with people about that, right? So
it was a great day. Looking forward to tomorrow, Saturday.
And then going home.
And then Sunday we're going to rent e-bikes and explore.
And do wheelies all over Florida.
Yeah.
Okay. That's it. See you next time.
All right.